sir.
Okay, here we go.
There we go. Perfect. So everybody, like I said, my name is Jonathan Chafee. I'm a reality check coordinator here in New York State. And myself and my coworkers across the state, the Advancing Tobacco-Free Communities grantees, wanted to offer this presentation as we're trying to educate our communities about the issues of menthol and flavors. And today we're really lucky to have two presenters that I probably most educated people on the topic that I know of. The first is Michael Scott. He's a CHES. He was hired at the Center for Black Health and Equity in October of 2015. He currently serves as the Chronic Disease Program Manager overseeing tobacco, cancer, and HIV/AIDS prevention and education programming. He has 18 years of public health experience on the national, state, and local levels. His work has focused on disease prevention in the areas of HIV, diabetes, cancer, and tobacco use prevention. Prior to his position at the National African American Tobacco Prevention Network, he served as a health education specialist at both the Durham County Department of Public Health and Duke University Medical Center. Mr. Scott holds a Bachelor's of Science degree in health education from North Carolina Central University and is a certified health education specialist. And then our second presenter who will follow Michael is Natasha Phelps. She's a lead senior staff attorney at the Public Health Law Center, where she provides legal technical assistance on commercial tobacco control and equitable public health policy issues to public health professionals and organizations, legal professionals, and advocates throughout the United States. Natasha also manages a team of attorneys at the Public Health Law Center that provides tailored legal technical assistance on local and state tobacco law and policy to communities, organizations, and governments in Minnesota. In addition to her work as an attorney, Natasha serves as secretary on the board of directors of the Center for Black Health and Equity and teaches as an adjunct professor at the Mitchell Hamlin College of Law. Prior to joining the Public Health Law Center, Natasha worked as a litigation associate at a private defense firm. So thank you two for taking time out to present to us and the community members here in New York State. And Michael, it's all yours.
Thank you, Jonathan. And just want to make sure my audio is coming in clear. Good. And I'm sharing my screen. So right now, all you guys can see is my one big slide. Perfect. Well, good afternoon, everyone. As Jonathan mentioned, my name is Michael Scott with the Center for Black Health and Equity. And we're going to be talking today about menthol and why it's an issue. And again, it's going to be two of us, myself and my colleague, Natasha. And I'm going to give basically a brief overview of menthol flavored cigarettes, and why the issue is important and why it's making a lot of noise right now. And I'm just gonna go ahead and get started because I know we've got some limited time. We definitely want to have time for question and answers afterwards. So I'm gonna go ahead and jump on in. And one thing I want to make clear before we start is just a quick disclaimer that when we talk about tobacco in this presentation, we're talking about the commercial use of tobacco and not the sacred and or traditional use as is done by our Native American brothers and sisters. So what's the big deal with menthol? Right now, I think the big thing on the street is the FDA actually being sued over menthol cigarettes. That's a huge topic going on right now. If you're involved in tobacco control, I'm sure that you've heard of this lawsuit, or at least heard of all the conversation going around about menthol and menthol flavored tobacco products. So I want to start off by just giving folks a brief history of menthol and what it is. And just really quickly, if folks can just type in, I'm going to ask a question, just chat in some of your answers. When you think of menthol, besides menthol flavored cigarettes, what other products come to mind? What does menthol bring to the forefront when you're thinking of menthol? and I'm seeing cough drops, I'm seeing gum, anesthetic, and that's exactly right. So when we think about menthol, we think about cough drops. We think about other products. Vicks Vapor Rub is always a popular one. Conditioner, shampoos, mouthwashes. So we do think of some things that have a healthy connotation. So menthol, in and of itself, does have a little bit of health consciousness around it. But it's when you add it to cigarettes, when you add it to tobacco products, that it becomes an issue, because now it's a flavor in a product that's harming people. Now, the history of menthol cigarettes dates back about almost 100 years, about 1924, 1925 is when we first saw menthol cigarettes hitting the market. And how they came about was purely by accident. This gentleman here, Lloyd Spud Hughes, is credited with creating menthol cigarettes. And as it turns out, he was an asthmatic. And what he would do he would use menthol crystals and breathe in the vapor from the crystals to assist in, opening things up and helping him breathe better when he was having, his asthma attacks or his asthma was flaring up. And he stored those crystals in a tin. He also stored his tobacco in a tin. So one night, for whatever reason, he stored them together. The next day, as he was smoking his daily cigarette, he noticed a strange flavor, a pleasant flavor. It was now easier to smoke. And he said, he thought other people would enjoy this as well. Began sharing it. Before you know it, now he's formed Spud Cigarette Corporation, the very first menthol cigarette. And since then, now we've got Newports, Cools, just a plethora of menthol flavored cigarettes for folks to choose from. But again, when we talk about menthol, what is it and what does it do? And as we said, it gave his tobacco a little flavor, a little minty candy taste, and it masks the harshness of cigarettes. So it makes it easier to smoke, makes you able to inhale more. It provides a cooling sensation, activates your taste buds and your cold receptors, increases that throat grab. For smokers, when you inhale, you kind of get this grab at the back of your throat. And that's what, folks that are switching from combustibles to e-cigarettes look for, that throat grab. If you've heard that term, that's what that means. So that cooling sensation, the taste buds, the cold receptors, it gets stuff flowing in your mouth. So now your cells are open, they're more permeable. It has an anesthetic effect, which means it kind of numbs things. So as you're inhaling this hot, toxic substance, now it's a little bit easier because it's got a little bit of anesthetic effect. It increases your salivary flow, transbuccal drug absorption, which is important. A lot of times, folks that use dip, snuff, or even cigars, since they don't technically inhale, they think maybe it's a little bit safer. But while that smoke is in your mouth, while that dip or chew is, tucked in your cheek, you've got more saliva flowing. The cells in your mouth are now opened more to receive more of whatever else is in that product, the carcinogens, the tars, the other poisons. So again, menthol provides that greater cell permeability. And when we think of menthol cigarettes, in the marketplace, we think of Newports, Cools, the green packages. And those encompass about 32% of all cigarettes sold in the United States. So slightly more than 1/3 of the entire market is menthols. However, when you look at the actual ingredients of most cigarettes, over 90% of all cigarettes and tobacco products in general contain some level of menthol. Even if they're not advertised as a menthol cigarette, they contain some level of menthol. because of those effects that we just saw. Without the menthol, the tobacco use, especially combustible tobacco, it would just be so harsh that menthol makes everything a little bit easier. And when we talk about who's smoking menthol cigarettes, it's important to look at that. We know 9 out of 10 African-American smokers use menthol cigarettes. And we're focusing on menthol right now, but we're talking about all flavors. Any flavored tobacco product is an issue. But we're specifically talking about menthol right now, but whatever we say about menthol, it can be true for other flavors as well. It's easy to initiate with a flavored product, and the flavors help, induce folks into starting and to maintaining use. And we'll talk about that a little bit later. And we also know that about 4 out of 5 young adults who have used tobacco reported that their first product was a flavored product. And that flavored product could have been an e-cigarette. For older folks, that first product was a combustible. And when we say flavor, most likely that flavor was menthol. And again, we know that flavors initiate e-cigarette use, especially with youth. My organization, and I kind of skipped through the intro because I wanted to give us enough time. My organization focuses strictly on menthol. The reason being is we're funded by the CDC to promote smoking prevention and education in priority populations, our priority population being African Americans. And as we said, 9 out of 10 Black folks smoke a menthol product. But we also have to look at it in smoking initiation. Most adolescents and young adult smokers start with the mentholated product and continue with that product. We know that menthol flavoring increases the addictive potential for smokers, and that flavors, menthol, fruits, candy flavors have been used as marketing tools by big tobacco. No matter what they say, we know that these flavors are targeted towards youth, towards minorities, towards folks with lower SES. And we'll talk about marketing in a few more slides, but it's obvious that this mentholated product, which is more addictive, is being specifically targeted to specific communities. And again, much more likely to be smoked by African Americans, and the advertising is much more likely to be seen in African American neighborhoods, especially near schools that have high proportions of African Americans. Now, smoking in general, we know that the rates are going down. They've been going down for years. So, kudos to that, because we have been successful in reducing smoking rates. But the tricky part about that is if we break it down into, who's stopped smoking and what they stopped smoking, we get a different picture. And I want to start on this slide with the graph at the bottom, adults 26 plus. So we see non-menthol use on that decline. However, we see menthol on a slight increase. When we look at young adults, the middle graph, we see an even greater use in menthol use, but still that dip in non-menthol. When we get to the menthol versus non-menthol for the kids, the 12 to 17-year-olds, again, downward spiral. And for menthol, it looks like it's going down as well too. So that could be a good thing, right? However, we need to keep in mind that this specific graph is showing us combustible tobacco use. It doesn't take into account e-cigarettes. And we know that right now, menthol, mint, those are the #1 flavors for e-cigarettes right now. So if we were to include menthol e-cigarettes in this chart, guarantee you that menthol line will be headed in the opposite direction. And again, who's smoking menthols? African Americans. I think that's pretty well established at this point. Almost 90% of African American smokers smoke a menthol product. But other populations also have an increased menthol preference. We see it in Asians, we see it in Latinos, even with white folks and the general population. Again, about 1/3 of the tobacco industry, cigarette industry, is menthol flavored cigarettes. And when we again looking at youth, teen smokers, we know that big tobacco, that's their deal. They have to recruit new smokers because the folks that are using their product, are dying. So they have to recruit new smokers. Teen smokers, the rates for menthol are even higher than the overall menthol use. We're looking at 95% for African Americans, 61% for Asians, 58% for Hispanics, 51% for white youth. So we can see that menthol in the younger generation is even more prominent than the overall smoking population. And again, I said, we're focusing on menthol, but there's other flavors as well. Particularly with these Black and Milds, Swisher Sweets, cigars, little cigarillos. Again, those are being marketed with any flavor you can imagine. And when we look at who's smoking those, who's using those products, again, we're seeing African Americans are using those products more often, and we're also seeing youth using these other flavored tobacco products, these cigarillos, these Black and Milds, more often than the general population. And a lot of that has to do with the marketing. So I mentioned the marketing earlier, and that slide said there's like something like 10 times more flavored or tobacco marketing in African American communities. And it's the same for African American communities, lower income communities. These photos were shared with me by Jonathan, and they're all from the upper, upstate Western New York stores, Schenectady. This one is, I think, Elmira. When you look at these advertisements, you look at all this, all you see is colors and flavors. And we know who that's attractive to. Again, more stores, more advertising. You can see the candy down here at eye level, but then right across the way, you've got every single flavor, tobacco product you can imagine. So every single flavor that's down here with the candy, it's probably up here and more so. You've actually got more choices of flavors for tobacco than you do for candy and gum in this picture. So again, 10 times more tobacco ads in Black neighborhoods than other neighborhoods. So, tobacco is not an equal opportunity killer. We know it's affecting specific populations more so than other populations. And a lot of that has to do with the flavors. Another way, not only are they marketing it more in African-American communities and other priority population communities, but they're offering it at lower prices. They're offering it at, more price promotions for these menthol products. This slide is specific to New York City. And when we look at price promotions, menthol cigarettes have the highest incidence of being offered at some sort of price reduction. Again, making the product easier to get for specific populations. And we know that removing flavors can and will help. So we know that a lot of the flavored in e-cigarettes have been taken off the shelf. They're not available, especially in New York. So we applaud New York for making one of the hugest steps in banning e-flavored products. But we also know that, removing menthol from combustible products will be beneficial. Taking it back to 2009, Smoking Prevention and Tobacco Control Act, menthol could have been banned along with, strawberry, grape, licorice, clove. Those flavored cigarettes were banned. However, the only cigarette that wasn't banned, only cigarette flavor that wasn't banned was menthol. Now, the whole idea, the whole process of, this ban was to protect families, protect children from smoke, from secondhand smoke. Allowing menthol to remain left a whole bunch of people unprotected. So, the question begs the question, why were these folks protected and these folks not protected? So the removal of menthol from the marketplace, again, we know is going to be beneficial. The FDA, the Tobacco Product Safety Advisory Committee report back in 2011 even said the removal of menthol products from the marketplace would be beneficial to the public's health. So if we know it's beneficial to the public's health, here we are 10 years later, why hasn't there been more action taken on the federal level? We know that removal of of menthol from the marketplace will have economic impacts. And later on in the presentation, when Natasha takes over, she's going to go into a lot more of the legal aspects of removing menthol from the marketplace and what that looks like, what it looks like currently, and what folks that are interested in pursuing something like that have to consider. And we'll get to that during Natasha's presentation. But we do know that removal of menthol, it's going to impact some revenue from retailers and whatnot. But we also know that a 1 percentage point reduction in smoking would reduce Medicaid costs by $2.5 billion in the next year. We know that removing menthol, we know that more menthol smokers would attempt to quit as opposed to trying e-cigarettes or as opposed to going to a non-mentholated cigarette. Most menthol smokers would try to quit as opposed to continuing smoking. So we know that menthol removal will have positive public health outcomes. And this is a projected number of lives saved. All menthol smokers' lives saved versus broken down to Black menthol lives saved if back in 2009 menthol had been included. So if menthol was included back then, and as a result we saw a 10% decrease in smoking initiation and cessation, we would have saved over 300,000 lives, 91,000 African-American lives. Same thing if we would have seen a 20% decrease in initiation and cessation and a 30% decrease in initiation and cessation, we see the numbers of lives, potential lives saved is astronomical. Sorry, y'all, that was my alarm. I'm also doing homeschool, so it's time for little one to get online. Before I let Natasha take over, what I want to emphasize is that menthol is a social justice issue. We see that African Americans are unfairly impacted. We see that youth are unfairly impacted. And we know that big tobacco is using flavors and targeting it towards these communities that are already, suffering from, other health disparities and other social justice issues. I've included a quote here from Phil Gardner, and I'm sure most of the folks on this call have probably heard Phil speak at some point or have heard his name. And he says that the disproportionate marketing and targeting of candy flavored poison to African Americans and other especially oppressed sectors of our society is discriminatory and genocidal. So again, it's the folks that have the least resources, least access to resources, the least informed, the poorest. These are the folks that are being preyed upon by big tobacco and menthol and other flavors. And these are the folks that need our protection. Protection being, if there's a product that is, having that much of a negative impact, there needs to be a discussion about how to improve that. And we know that removal of menthol from the marketplace will work. But, what does that look like? How does one go about doing that? There's been a lot of success across the country with that. And I'll pass it over to Natasha so she can discuss a little more about what that looks like. And then we'll go into a little question and answer, as I'm sure that there's going to be, some questions that folks have about menthol, maybe some detail that I didn't include. Because I know I wanted to include as much, but save time for Natasha and for question and answer. So again, if there's any questions, we'll have a question and answer period. And I'll shoot folks my email and Natasha's email. And if there's other questions, we can always continue the conversation offline. So Natasha, I will stop sharing my screen and let you share yours.
Thank you, Michael.
Of course, technology is doing its thing. Okay. Hit it. Thank you, Natasha.
Oh, all right, cool. Thank you, Michael. Let me just pull my presentation up. All right, Michael, can you give me a thumbs up if you can see my screen? Okay, great. So hello, everyone. I am Natasha Phelps, like Michael and Jonathan said earlier. I am a lead senior staff attorney at the Public Health Law Center, which for those of you who don't know, we're a legal nonprofit center located in St. Paul, Minnesota, on the traditional homelands of the Dakota people. And what we do is we provide free legal technical assistance to communities, governments, and organizations all across the country. You may have worked with another legal center on commercial tobacco related issues in the past, and we work very closely with those centers. We actually are the hub of the legal consortium of commercial tobacco. So that's maybe why you've heard of us before, even if you haven't worked with us. But today I am here to talk to you about flavored tobacco regulation. I'm really just going to be talking about what the authority is, what are the components of these types of policies, and what are the trends that we're seeing. I'm going to include within that conversation the litigation that we've been seeing to date. But just note that I am not advocating for any particular flavored tobacco policy or any commercial tobacco policy in general, but just providing evidence-based reasons for why this policy may be effective in your jurisdiction.
Exactly.
So this is the commercial tobacco team at the Public Health Law Center, in case any of you may have worked with some of us. But we provide the free legal technical assistance on a tribal, federal, state, and local level. So I know that there are a couple of people who work on different government levels, and just know that I'm going to try to apply this conversation to all jurisdictions, although some things will be specific to more so to others. So as Michael said, the Tobacco Control Act that was passed in 2009 prohibited the use of artificial or natural flavors other than menthol and tobacco in cigarettes. So yes, it left menthol out, even though there was overwhelming evidence for why menthol was probably the most harmful of all flavors in commercial tobacco products for all the reasons Michael already stated. What the Tobacco Control Act did do, however, is authorize FDA to set additional tobacco product standards, which means saying to manufacturers, you cannot put this type of ingredient or constituent in your product, including the removal of menthol from cigarettes. So it actually explicitly provided the FDA with the authority to do what the Tobacco Control Act didn't do with menthol and cigarettes. And it actually charged the FDA to establish a committee, that's the TPSAC, to come up with a recommendation on action to address the impact of menthol in cigarettes. And it did specifically call out the health inequities related to menthol cigarette use. The other thing that the Tobacco Control Act did was that it not only noted that state and local governments could pass regulation on the sale of tobacco products, it preserved their authority to do so. So while it did reserve that ability to prevent a jurisdiction that was not the federal government, that was not the FDA, from being able to say, manufacturers, you can't put this ingredient in your product, they did say that state and local governments could say you can't sell a product, a specific commercial tobacco product or commercial tobacco product in general in our jurisdiction. And so a lot of jurisdictions, since the Tobacco Control Act was passed, have passed flavored tobacco sales regulations to kind of fill in the gaps of what the Tobacco Control Act failed to do and what the FDA has failed to do since that time, because the FDA has not yet taken action on menthol flavored cigarettes, for example, cheap and flavored cigars, and many flavored e-cigarette products, just as an example. And so what a lot of state and local governments have done is pass these flavored tobacco sales regulations. What does that, how do they typically do that? What does that typically look like? Well, from what we've seen so far, on a state level, that's done through legislative action or executive action. So perhaps some of you have been paying attention in the last couple of years in the news with this youth vaping epidemic, and a lot of governments responding to this emergency of lung injuries caused by the use of e-cigarettes. And so a lot of executive action was taken at a state level to address this problem. Some of that being regulating the sale of flavored tobacco products, specifically e-cigarette products, but that has, as you'll see later, extended into other commercial tobacco products as well. On a local level, this is usually done through a local licensing code. You know, if a local government has the authority to license tobacco retailers in their jurisdiction, typically a government will then prohibit the sale or restrict the sale of flavored tobacco through that licensing regulation. And it's just easier for a variety of reasons that I can talk to any of you about later, but it can also be passed as a standalone sales ordinance. And I know that this is a lot of writing on the screen. Here I'm talking about the drafting, what the components are of these regulations. But I'm not asking you to read all of the font on the screen before I move on. I really have this on here so that if you would like a copy of this PowerPoint, you have the information that you need here in order to start a conversation or to engage with stakeholders about how this could look. And of course, we are always open to consult with you about what that could look like if there's authority in your area. So just really briefly, I wanted to touch on the three major components, which is a purpose and findings section. Like Michael already went over, there's an abundance of data showing the damage, the allure, and the harms to society, not just the individual person, associated with flavored tobacco products. So you want to make sure that that's clear in your purpose and intent and findings section. Then the next important part is to have clear and consistent definition. So you want to have a comprehensive definition of flavored products, which typically is tied together with a comprehensive definition of tobacco products in general, or licensed products, without any exemption for flavor or for product type. So Michael mentioned not exempting the flavor of menthol, yes, and not exempting, certain products like e-cigarettes. This helps to have a comprehensive definition, and you'll see why that's important when we get to the litigation section. Some jurisdictions have left certain products or flavors out, but it does leave a community susceptible to litigation, and then it is difficult to compare that to your purpose and intent findings when you have those exemptions and it conflicts with the evidence. And so another thing to note about definitions is it's including language that has some presumptive evidence, so that people who are enforcing the law and also retailers who are trying to comply with the law understand what a flavored tobacco product is. So for example, in our model language, we have language that says, something about that a flavored tobacco product you can know it's a flavored tobacco product if the manufacturer has made some type of statement or claim about the fact that it's flavored. So for example, if the product is labeled Tropical Breeze and an enforcement agent is not sure if that product is flavored, but there's a sign by the product that says, it'll make you feel like you're sipping a pina colada on the beach on vacation. That's an example of how they would be able to say confidently that the product is flavored. The third component that I wanted to touch on briefly is the sales regulation itself. And we really think it's important, and I think all of the litigation that's been upheld to date has shown that language should be really simple for a full flavor ban. No person shall sell or offer to sell any flavored products. And then you define flavored products, of course, with all the consideration that I just went over. Now, within the sales regulation itself, some jurisdictions have exempted certain retail establishments from these regulations, like adult-only tobacco shops and e-cigarette shops. And I'll talk about why these exemptions are problematic, but mainly the thing to think about is the reasoning behind these types of exemptions and whether the evidence actually supports that. So for example, a jurisdiction may be interested in exempting adult only or 21 plus tobacco product shops, thinking that, well, the intention is to prevent flavored tobacco from getting in the hands of kids, and they can't enter into those stores because they're not 21 or older. When actually the data shows, when you're looking at compliance check data, that actually a lot of underage people are getting their commercial tobacco products from these establishments. So just make sure that you're consulting with a lawyer. Like I said, we are available to you if you have questions. But in general, exemptions can lead to a lot of unintended consequences. I think the biggest example here is the city of Minneapolis in Minnesota, where I live. They passed a flavored tobacco regulation that exempted certain retailers, including 21 plus tobacco product shops. And they saw an extreme increase in tobacco retailer density. Many retailers started to apply for tobacco retailer licenses that didn't previously exist because that was a privilege that the ordinance created. And they saw a money making opportunity in that. And then also establishments that were no longer able to sell flavored tobacco products, like a gas station, because they weren't a 21 plus shop, actually responded in a way that tried to get around that exemption. So they created makeshift tobacco product shops, stores within the gas station, and called it a 21 plus tobacco product shop. And so this leads to a ton of issues. They actually had to put a moratorium on tobacco retailer licenses for a period of time until they could figure out how to resolve the problem. And so, there are other reasons why exemptions can lead to unintended consequences. That's just one I wanted to highlight. The other thing to think about is that exemptions can result in ineffective or less effective policy. I mentioned the fact that tobacco shops often do fail compliance checks more often than non-21 plus tobacco product shops. But also the other thing to think about is exempting certain products and certain flavors does not align with the evidence, because if you are thinking, well, let's exempt menthol because adults smoke that too. Menthol actually is the most desired choice by young people to start initiation in, yes, combustible products like cigarettes, but also in e-cigarette products. So just be really thinking about these things and understand that if you are ever challenged by the tobacco industry and you have exemptions that don't align with the evidence, it's going to be difficult to defend the policy. And just a last reminder is that the tobacco industry wants exemptions and has pushed for that in many communities, which I'll come back to in a second. And then lastly, I did state and local, and I just wanted to mention that a lot of tribal communities have also passed flavored tobacco regulations. The Muckleshoot tribe, the Polyap tribe, and the St. Regis Mohawk tribe have passed flavored tobacco regulations on tribal land. And so that's an area that is developing as well. And just to be really clear, the tobacco industry is pushing for exemptions in all communities that are working on this, using many tactics that I won't get into in detail, but they are often appropriating really very real issues like police brutality with really false evidence, fear tactics, and money to politicians, community leaders that are already facing lack of resources to be able to work on other causes. They are hiring grassroots organizers to organize small business owners to come together to say, don't close our neighborhood stores. And I would just really challenge, what I've seen is a lack of challenge of those retailers to show actual evidence that their profit is being reduced. Because so much of their revenue actually goes back to the tobacco industry. So I could go through all of these kind of tactics that the industry fuels to push for exemptions with these policies and debunk them, but we just don't have time for that. So I'm happy to talk more during Q&A or offline. So then next I wanted to move into some trends of what we are seeing currently. We do have now 2 states that have passed a flavored tobacco sales regulation. The state of Massachusetts, actually the governor had signed an executive order, off of that youth vaping epidemic in response to the youth vaping epidemic, and that has since been expanded to additional commercial tobacco products. So it's pretty much a full ban of the sale of all flavored tobacco products, with one very small exemption, which is for retailers that allow for on-site consumption of products. So you can only purchase flavored tobacco products if you're going to consume on-site. And in Massachusetts, under their clean indoor air law, there are some circumstances in which that may occur. Other states that might not actually work because of clean indoor air laws. Then the state of California also recently passed a flavored tobacco sales regulation, which is essentially also a ban. Both states include menthol cigarettes, but in California they did exempt specific products, not flavors, but products. So they did exempt flavored hookah, premium cigars, and some pipe tobacco. There was a referendum on that California law that was signed by Governor Newsom, and so it will be on the ballot in November 2022, but it has been signed into law. And then there have been many, many localities across the country, I haven't listed them all here, that have passed flavored tobacco regulations, with the most being in Massachusetts, California, Minnesota, in Colorado now coming up as one of the most active states. We have a lot of big cities across the country. And just as far as the trend goes, early on, before it was tested in the court, the jurisdictions like New York City and Providence, Rhode Island, were very limited. They exempted a lot of products, they exempted certain flavors, they exempted certain retailers. And then as the litigation has upheld public health, these regulations across the country have become more and more comprehensive. And so now the current trend is to do a full flavor ban, or to prohibit all flavored tobacco sales within the jurisdiction without exception, or to prohibit all flavored tobacco sales without any type of exception for flavor or for product, but exempting certain retailers like 21 plus tobacco product shops. So that's really the trend that we're seeing now. And briefly, because I want to leave time for question and answer, I'm going to just really kind of breeze through the litigation challenges that we've been seeing, kind of by telling a story. So like I said, in the very beginning, the jurisdictions that passed flavored tobacco regulations did exempt quite a bit of flavors, product types, and retailers. And so and that was because, it hadn't yet been challenged in court. They didn't know what the courts would say about that. So the first time we really saw the court looking at this issue to determine whether the Tobacco Control Act prevented state and local governments from passing these types of regulations was in New York City and Providence, Rhode Island, when the tobacco industry sued both of these jurisdictions. And in both cases, the federal courts upheld the flavored tobacco sales regulations. It's important to note that in these early litigation circumstances, menthol was not included. But then Chicago passed a flavored tobacco sales regulation, including menthol. It did only apply in certain buffer zones in the city, so it wasn't throughout the entire city everywhere. But this is the first time we saw menthol was included, and again, upheld by the court. And so that's when people started to say, okay, we can include this, we can go forward, and we can get a little bit more bold with our regulation, because they were feeling confident because the court was continuously upholding public health in their movement. Also in the litigation sphere, Massachusetts towns were passing a lot, like you saw on the slide before, a lot of flavored tobacco regulations. And this question of how they determined whether something was flavored, and how a court would also review whether the way that they found it was flavored was okay or not. And so in Massachusetts, Cumberland Farms, which is a gas station, a retailer in the state, sued the county of Yarmouth to say that the way in which they determined a product was flavored was unlawful. So the counties and cities and townships in Massachusetts were using a list that was compiled by a health board that included a lot of internet research, for those statements that I was talking about, many different things. And then also the enforcement agent and also the court performed a smell test. So if a product looked like it didn't say that it was flavored on the package, but when you open the package, a citrus aroma comes out, that type of smell test the court found to be lawful and not arbitrary or capricious like the tobacco industry was arguing. So again, more of the court upholding what public health and local jurisdictions have been doing to protect public health against flavored tobacco products. San Francisco became the first jurisdiction in the entire country, or the first, major city in the entire country to prohibit the sale of all flavored tobacco products without exemption, so that full ban. And interestingly enough, the tobacco industry did not sue San Francisco, even though San Francisco was ready for a lawsuit. Instead, they went around and they funded really heavily an expensive ballot measure to repeal the ordinance, and they lost. The voters actually upheld the ordinance, and so they were not successful in a ballot measure, and they had, again, not been successful in court. So it's just showing that the tobacco industry sees that this is a losing game. Now for the more recent ongoing cases. In California, there are a couple of local and then a case against the state for their flavored tobacco regulation. LA County and San Diego County have both been sued by vape associations and RJ Reynolds for their flavored tobacco regulation. LA County was a full ban, and the court actually denied, after the tobacco industry sued LA County, the court actually denied the tobacco industry's request to prevent implementation of the policy, because the court, in a really scathing opinion, found that the tobacco industry was really unlikely to succeed on the merits of their claim. And so they did not prevent the county from implementing the flavored tobacco regulation. And so then the court went on to actually dismiss the tobacco industry's claims and granting the LA County's motion to dismiss. So RJR did appeal that decision, and that appeal is ongoing. Then in San Diego also passed almost a full ban, including menthol cigarettes, but not all flavored shisha, and only limiting the e-cigarette regulation in a specific way. They were sued by vape groups and RJ Reynolds. And then I just wanted to also mention the state tobacco litigation, because when the state passed their flavored tobacco regulation that I already mentioned, RJR, Philip Morris, and a couple other industry players sued the California Attorney General, as well as the San Diego DA at the same time. So it brought that San Diego and California state litigation together. That litigation is ongoing. We are waiting to see what happens with that, but a motion to dismiss on behalf of the state and San Diego County has been filed. So we're waiting to see what happens with that. And then a success in Minnesota, the city of Edina passed a full flavor ban, and the district court in Edina found that it was, again, not preempted. So this was the first time we had a decision from the court saying that a full ban, all products, all flavors, no exemptions for retailers, that was not preempted by the Tobacco Control Act. And so that was a huge win for public health. So we now have many levels of the court finding that states and local governments can go ahead and pass these types of policies. This is on appeal. RJR did appeal the decision, and we are waiting for that to move forward to oral argument. But the message is that, to date, all litigation has been successful for public health. And then briefly, I just wanted to mention a case in Philadelphia and a case in Missoula related to a local flavored tobacco regulation in that area. But that is the reason why I don't really want to talk too much about it, is because the claims are about state preemption. The tobacco industry is arguing that, the state constitution in these two jurisdictions do not allow for the type of flavored tobacco regulation that these jurisdictions have passed. So this is the outcome of these two cases will not be relevant necessarily to the federal preemption cases, but I thought it was worth mentioning. So some of the key takeaways really quickly is that a flavored tobacco sales regulation is an effective policy to protect public health and advance health equity, and all decisions to date regarding flavored tobacco regulation have been in favor of local government's efforts to protect public health. And so communities should feel comfortable that they're not preempted under federal law from passing flavored tobacco sales regulations, including full bans, based on what we know about the precedent so far. And so if you do draft this type of policy, it should be based on solid legal grounds and on the evidence. We do have tried and tested language now that we've had so much litigation. But the tobacco industry is concerned about the momentum for policy change. They do continue to infiltrate communities to push for exemptions and to end those efforts entirely. But we do have resources to help people who are considering these types of policies. And you can talk or reach out to us if you would like tailored legal technical assistance on any of these areas. And we can also provide litigation support. So I will turn it back over to Michael for Q&A. Or Jonathan, I'm sorry.
Thank you. And I am going to share my screen one more time. I think I am. There we go. So in the chat, I mentioned an event coming up. I don't see any questions, so I'm just going to talk about this for a really quick moment. We have a Menthol Academy coming up next week, as a matter of fact. Natasha will be actually part of the panel. And what this is, it's going to be a webinar. It's a half a day training. I think it's 11 to 4:30 or 5 o'clock. So it's a pretty significant time commitment, but it is going to take a very much deeper dive into menthol restrictions and successful ban and restriction campaigns. So if folks are interested in learning more or are already involved or wanting to get involved, I would suggest registering for this this Academy panel. And seats are limited. I think we're limited to about 200 seats. We're hoping 10 people per state. But we'll do our best to include as many folks as we can to participate, and it will be recorded. So if you're unable to attend but are interested in learning more about it, there will be sessions of it, portions of it that are recorded and available for viewing later on. Also coming up is our No Menthol Sunday event. No Menthol Sunday is a yearly event that the center has facilitated for the past 7 years. And although it was created as a faith-based event, it does not have to be implemented at a faith-based institution. State department, health departments, local health departments, CBOs, organizations, whoever can actually participate in No Menthol Sunday. And it's really just a day focused on getting education out to the community about the negative impacts of menthol flavored tobacco, specifically on African-American communities and other priority populations, including youth, LGBT, anyone who smokes menthol at a higher rate. Because when you look at those populations, they're smoking menthol at a higher rate and they're suffering worse consequences from tobacco use. So I'd love to, I know we've only got a couple of minutes, but I'd love to have a couple of questions if folks have any. I haven't been monitoring the chat. So Jonathan, if there's anything in there, or if there's any questions from last time that you think might be beneficial, we can go over those if you remember what they were.
I remember, I haven't seen any questions, but I remember one from the first presentation you did to my coworkers and I, with the issue of if places are looking to ban menthol or flavors. It was brought up the argument that will allow law enforcement to target people of color. Can you and Natasha talk about that argument that the industry likes to promote and bring up?
Definitely. And I'll touch on it quickly, and then I'll let Natasha touch on it as well, from the legal side of things. But and that question, that concern is probably one of the most concerns that we hear brought up. It's going to give the police an opportunity to, interact more with young Black and brown men, get them involved in the system. And Natasha touched on that a little bit in her presentation, and I'll let her go a little bit more deep in detail on that. But with menthol restrictions and bans, it's not about the possession or the use of the product. It's all about the sale of the product. And when we talk about, police using this as a way to initiate contact, and I read an article about this. I wish I could have had time to update the presentation. A representative said that from law enforcement said that this is a way that police can use creative policing to engage, and then find something. So, when we talk about the actual implementation of something like this, it does not include law enforcement as the agency to do any type of enforcement. And Natasha, this is your wheelhouse more so than mine when we talk about the legal aspect of it. So I'll let you take over from there.
Michael, yeah, so there's two parts to this. So yeah, so Michael, you're right. I mean, the main thing is that flavored tobacco sales regulations are regulating the sale. They're not regulating purchase, use, or possession. They're not about penalizing people for purchasing, using, or possessing flavored tobacco products like menthol cigarettes, for example. Okay, so that's one thing. That's just definitively the answer. Now, the other component of this, that actually people who are bringing this issue up don't flesh it out, is the prediction, which typically is not backed up with evidence to show that, well, if you prevent the sale of flavored tobacco products, then you're creating an illicit market for untaxed or unstamped menthol cigarettes from other states that people will be selling on the corner, for example. And this will be Black and brown men, Black and brown people selling this in Black and brown neighborhoods as an illicit product. The problem is that there's no evidence to back this up. So there was a study that was done in Canada when they prohibited the sale of all their flavored tobacco products to show that illicit trade did not increase once flavored tobacco products were taken off the market. We have yet to have a study like that in the United States, and there are market differences between our two countries. But I think it's really important that we're noting the lack of evidence to show that either an elimination or decrease in the market of flavored tobacco products will increase illicit trade of those products. So that's one thing. Within that same point, we really need to continue to return to the fact that police brutality, police violence, incarceration, unfair criminal court dealings, these are issues separate from public health regulation. You can have the most fair regulation, the most fair policy, the most fair law written in the books. And if police brutality, violence, discrimination, and oppression continues to be a problem, it's going to continue to be a problem. You could write a law that says anybody who is walking down the street in a yellow hat will receive a lollipop. And if there's still a problem of police brutality, violence, and discrimination, you're going to continue to see that. And so I just wanted to really separate those issues because they're very real. It's not denying that those things are real. Lastly, I just want to say who is pushing out these talking points. These are tobacco industry fuel talking points. Yes, there may be separate faces to those talking points. They may pay organizations, I'll just say explicitly like the NAN organization that Reverend Al Sharpton has put together with the Black Law Enforcement Network, receiving tobacco industry funds to unfortunately bring these talking points into communities, Black communities, communities of color. And to that, I will say that the tobacco industry is one of the only industries in the country that if their business model is successful, Black people will die. So for them to be fueling and funding the talking points of, police brutality and thus appropriating this very real fear and issue that needs to be resolved is disgusting because they don't care about Black health, Black lives, Black problems. They don't care about that. They actually, in their own industry documents, have been pushing for a very long time to have people, the users of products, the purchasers of products, whether they're underage or not, they want them to be punished. They don't want to take responsibility on themselves. So anything they can do to refocus the narrative on, how individual people are going to be punished, they will do. And it's a joke, it's offensive, it's disrespectful, and they've been doing that for a long time. So, I mean, if you're facing these problems, I really encourage you to work with the Center for Black Health and Equity, to be able to work with communities in the area that may have unfortunately been influenced by these messages because they're based in very real fear-based talking points, and they shouldn't be dismissed like they're nothing, but they are not true.
Right. And just to add one really quick piece to the end of that, we work with 7 other organizations that work with other priority populations. So even if your program, your area is not working with African Americans and tobacco use specifically, Our funding stream, our sibling organizations, there's 8 of us, and we all focus on specific priority populations that are disproportionately being impacted. There's the LGBT network, the Hispanic network, Native American, folks with low socioeconomic status. Ooh, I'm missing a couple.
I don't remember.
Rural residents, and I said Latino, I said LGBT, but if you have a population of folks that are being impacted, one of our networks specializes in that specific audience. So even if it's not African Americans and tobacco use that your focus is on, you can reach out to myself and I can connect you with another organization that does, that targeted education and prevention work with those specific populations.
And then one last thing, Jonathan, I'm sorry, but in the crafting of these flavored tobacco regulations, you can decide, you can authorize the appropriate enforcement agent of this law. So it doesn't have to be the police who are enforcing the law in your state or in your local government. If you can allocate funding for public health to do it or for some other authorized agency or organization to be in charge of that, that's fine. I think one example where this comes up a lot is with tribal governments and who is enforcing these types of policies when you have non-tribal retailers on tribal land. There are a lot of things to talk about. It's not just like this is a problem that can't be avoided. You can actually write it into the law if you are concerned about that, and you would rather just make sure that the enforcement agent is not someone where this would be an issue. So that's another solution.
Any other questions from anybody? So, and Natasha, don't ever be sorry. I mean, the information that you and Michael are sharing is great for everyone. So
Definitely. Thank you. So yeah, so if there is no more questions, again, feel free to reach out to myself or Natasha offline. Our emails were in the presentation and Jonathan has them. But again, we look forward to any further conversations you may want to have, or if your organizations are looking for further trainings, please reach out. And if our organization isn't the specialty in that specialty population, we definitely can connect you with other organizations who have connections with those specific priority populations. So thank you, everyone. Thank you for staying over a few minutes, and feel free to reach out if you need to. Good. Thanks, Natasha.
Thank you.
Thank you, everyone. Stay safe out there. I can't talk for Michael and Natasha, but New York State